Hello everyone. Today I'm going to be talking about the modified Thomas test assessment. The modified Thomas test is a flexibility assessment primarily used to evaluate hip flexor and iliopsoas flexibility. The assessment is also used to see imbalances and limitations of the hip flexors, hip capsule, and rectus femoris. The purpose of the assessment is to detect any imbalances that would affect pelvic alignment. A poor score in the assessment would have a very big effect on the way one's exercise program is structured. Before attempting the test, proper warm up is required for the best results. The lying knee hug is great to start off to warm up the hip flexors. The position should be held for 10 seconds. Stretch should be repeated for a total of 3 times on each leg with 2-second rest in between each set. The quadricep stretch is another stretch to be done before the test. The position to be held for 15 seconds and exercise is repeated twice on each leg with 2-second rest in between the sets. To begin the assessment, the client lays on a table or bench supine with the edge aligned with the center of the hamstring. The client then pulls both legs to the chest with their hands on their hamstrings. Once in position, the client releases a leg so that it extends off the edge of the table or bench. Completing the test using a flexed release leg will show any limitations with the rectus femoris. The assessment should be completed on both legs for 3 to 5 trials, 2 to 3 minute rest in between each attempt. So I begin in the correct position and lay back and bring both knees to the chest. I slowly drop one leg so that it extends off the edge of the table. Common errors when testing: not maintaining proper position with the hips off the edge or the table or bench, not controlling pelvic tilt. This error will actually lead to an invalid test. External leg rotation, muscle tension, failure to bring both legs to chest as far as possible, and an arched back. For the example testing sheet, I provided a graph, and you can see the angle of the goniometer. It's a good indication of whether you pass or fail. Leg position plays a big role to determine any imbalances or weaknesses that need to be addressed. And a lot of testing uses results that are either determined by good, borderline, or needs work. For use in exercise program, stretches targeting weaknesses and imbalances from the test can be designed into the client's exercise program after evaluation and be proven to be very beneficial. Along with stretching exercises, strength-focused exercises should be prescribed to help strengthen muscles. Implementing these changes can help greatly with the client's fitness goals.